In the province, health experts have said, not just in Manitoba, of course, but nationally, that contact tracing alongside testing is really key to efforts to limit spread. In Winnipeg, people with COVID-19 tell CBC News they have lost faith in Manitoba's ability to properly trace their contacts. Some of them have been waiting days to get a call from Manitoba Health. Laura McQuillan is on that story for us this morning. What is the problem there?
Yeah, what we're hearing, Heather, is a number of people who have tested positive for COVID-19 waiting by the phone for that call, and it never came. Or in one instance, it took 6 days to get the call, but others, we're talking upwards of a week. And of course, the COVID Alert app is an option, but they weren't given codes for that either. So let me take you through the cases of 3 men in Winnipeg who've spoken to CBC News. One of them tested positive a week ago today. That same day, a nurse called him to tell him to write down the names of his recent contacts. So that's a week ago today. He's still waiting to hear back from anyone who wants that list of contacts. A second man tested positive last Tuesday. He waited and waited for a call from contact tracers, then eventually told his contacts himself. Finally, on Monday of this week, so 2 days ago, he got a call from a contact tracer. He was actually on the phone to CBC News at the time, talking to us for this story. And the third man that we spoke to tested positive 10 days ago. He didn't get any results for 4 days, so he tried to track them down himself. 3 days later, so a full week, he got that positive result, but now 10 days on, still no call. Now, we spoke to those men about what their concerns are with this whole process, and here's what they told us.
Aside from the initial phone call that told me I was positive, I've had zero contact from anybody in Manitoba Health whatsoever.
I'm a little nervous just about the amount of people out there that may be exposed, and my kids were allowed to go to school while I was waiting for my results. My wife had been going to work occasionally while I was waiting for my results. So makes me a little nervous that my close contacts were allowed to be out and about.
Zero contact. He's nervous. It makes you nervous to hear him talk about the situation, Laura. What is the province saying in response?
It is saying that the rise in cases that it has seen in Winnipeg is the reason that those contact tracers can't keep up. I want to show you what the numbers are looking like. This is from Winnipeg Regional Health Authority. Now, at the end, the right-hand side of that, that's the recent cases. We're talking about 88 yesterday, but a month ago it was 20, so it's quadrupled in a month. We're hearing from Manitoba's top doctor, Dr. Brent Rusin, that all of that is taking a big toll on those contact tracing efforts.
That's certainly not the norm, to be waiting 7 days to be contacted. Definitely, that's not our goal. We need to be contacting people, having them, advise us of their contacts, getting contact notification much quicker than that.
And so what Dr. Rusin said is they are working to ramp up that contact tracing staffing. They're getting help from the federal government. They also have a deal with the Red Cross to carry out contact tracing, and it is expected to hire dozens of staff right across the country to help out in Manitoba. The other side, of course, that COVID Alert app, these men have not received codes that they would put into the app, which would then ping any of their nearby contacts to tell them they might have been exposed. That's an issue that I have reached out to Manitoba and Winnipeg health authorities about this morning to find out how many codes are they giving out, why were these men missing out. But Heather, every day this week you and I have spoken about contact tracing across the country and the issues that provinces are facing. Now another province added to that list.
We'll talk about this with Dr. Gupta next hour for sure, Laura. Thank you very much, Laura McQuillan.